so excited. It's been a few weeks since we've had Friday Facts. I've missed you all in this context, though a number of us have been meeting on other North Carolina Serious Illness Coalition topics over the week. Yes, everyone, please share your name and organization in the chat. And if you have any questions, go ahead and share them. I'm so excited for this interview. We have Alie Chandler, the director and owner of Ossia Music Therapy. She's a board certified music therapist. And we're going to dive into the interview in just a second. While people are logging in, I'll start to give some announcements. Stay tuned. Join us next Friday for our monthly meeting, October 21st. We start at 11 o'clock, our monthly meeting time, and we have a really great, in addition to our usual agenda topics, our featured discussion is addressing health equity and health disparities in healthcare delivery, healthcare research, healthcare advocacy. So really excited to have Dr. Tamara Baker back. She was on a recent Friday Facts. She's going to help with our coalition member, Harold Barnett, and so hoping to have a really good discussion. And also stay tuned, look in your emails for more information about our first virtual conference, Joining Our Voices. How appropriate to be talking about voices today with music therapy, but Joining Our Voices, envisioning the future of serious illness care. That's our first virtual symposium from November 14th to 18th. It will be, or a virtual conference, it will be 1 hour each day. So stay tuned for more information about that. So excited. And now we're going to get started. We have Alie Chandler with us. We're going to learn all about what music therapy is and her work as owner of Ossia Music Therapy. She's a neurologic music therapist. She's got a lot to tell us, and we were just discussing offline how it's morning and we're all trying to get our voices waking up, and I gave her permission if she wants to sing or do any vocal exercises during this interview. But welcome, Alie.
Thank you. Thanks for having me.
It's so good to have you here. And I do feel like, as point of honesty, full disclosure, Alie and I have been longtime colleagues, but never worked close enough and decided we needed to rectify that. And now we literally work in the same office building. She's in the office next to mine. And it's through the discussions I literally get to see and hear her work. And I said, you know, I think the North Carolina Serious Illness Coalition really needs to learn more about what you do and what music therapists do. So I'm really excited you're joining us so early on Friday morning.
Yeah, thanks for having me.
So we want to know all about, and even though I'm right next to you, there's so much I want to learn. I had so much fun stalking you on your website. And so I have a lot of questions. But before we dive into, you know, what is music therapy and what's a music therapist, share about your background. Where are you from and what shaped your passion for music?
I'm from Tennessee originally. I grew up with a very musical family. My dad and all his brothers and sisters, all 13 of them singing in harmony, maybe, 5-part harmony or whatever. Grew up with that, and my mom is a nurse, so I grew up with a lot of healthcare exposure, and just knew I, had to do the perfect marriage of the two, the music and the healthcare. So always was interested in music and how it affects your brain. And I experienced firsthand, I was in childcare, working during the summers at University of Tennessee Child Development Labs. And I got to work with a child with autism on the spectrum, and just saw how he was, so drawn to music and how I could connect with him through music. So that started that passion. And my undergrad didn't really have a music therapy, or did not have a music therapy program. I didn't really know about it until I was a freshman. So I did a music degree there, and then I went on for a master's in music therapy at Western Michigan. Then moved to New York and worked, and then moved back here to North Carolina. So,
Wow, there's so much. I mean, I can't even imagine your childhood. What a beautiful sounding childhood.
Yeah.
Aunts and
Oh,
uncles. So then tell us, so you decided to go into music therapy, educate all of us. What is music therapy? How would you define what you do and the practice?
um, well, I guess technically it's an allied health profession. We work closely with OTs, speech therapists, psychologists, a whole team. We use music as our tool, basically. So we're trained in not only music, we're musicians, but we're also therapists. So we have the neuroscience and the therapy trainings. And so that's the main goal is targeting non-musical goals and sometimes musical. It all kind of commingles, targeting those through music.
Yeah, well, there's so many questions I want to ask. I want to call out your website because it's and I like to do it at some point. I'll do it again. It's Ossia musictherapy.com because there's so much information on there and it was so fun to learn about it. So in terms of the specific ways that you work, I know you talk about your work with folks with Parkinson or your Parkinson's or your work with individuals who have the autism spectrum disorder developmental. What are some of the ways that you work with them and how that it can have those non-musical effects, but these therapeutic effects through music?
So many ways. I primarily work with adults right now. About half of my work is with people with developmental differences and on the spectrum. And then the other half is older adults with dementia, post-stroke, Parkinson's, any kind of neurological issues or diseases. So it's very different. Every day is extremely different. Every hour is extremely different. There's so many techniques. I also have a neurologic music therapy training. So we have very specific names for all of the techniques. And for example, in stroke recovery, I work with a lot of people with aphasia, which is a language disorder. Hopefully you've heard of it. And we can actually use music and elements of music to to target language in a different way. So we're actually building new pathways to language, to speech. So that's the best thing about music is it engages the entire brain. It's not centralized. It's very, very spread all over. It can actually even, let's see, your motor neurons, I'll give you an example. Your motor neurons line up when you hear a steady beat. So even at the spinal level, your body is reacting. So they line up, get primed, ready to move. So in Parkinson's, that's a huge, like, amazing effect of music, and music therapy is just that rhythm and having that act to help with walking gait or any kind of movement. So just taking all these elements within music and applying them systematically for the betterment of any person.
Yeah, it's so exciting. It's a bit magical. A number in the way that there's connections. As I said, I was thinking about it yesterday as I was looking on your website and following you have a great video on the melodic intonation. And a number of months ago on Friday Facts, we had Teepa Snow on, who was talking about brain changes. And I know what language on the left, rhythm and emotion on the right. And you specifically have exercises where you talk about tap with your left hand as you're making this sound. And I'll let you tell the story about why tapping with your left hand versus your right hand. I mean, this is the kind of cool science, or is what I said, magic about it, but.
Right. Yeah. It seems like magic, and it's all, very scientific. Luckily we have all the brain imaging to know now how music is affecting your brain. So yeah, if you're tapping with your left hand, you're activating the rhythm centers in the right side. and there's also parts in the left speech centers, that connect with the lyrics, and that's a good way to retrain. So melodic intonation therapy, I've done with many folks, and some folks can just say one word all day long, but if you have a little melody and a rhythm, then you can say, how are you? How are you? It's just using different neural pathways. So it seems very magical, and it is in a way, but it's also science-based. So.
Well, and I've been watched for many years. I worked at a retirement community that had skilled nursing, and for years now, there's been a lot of talk about having the programming include a lot more music involved because of what they're seeing in the music impact on brain changes, and that even as the brain changes, as areas are declining, the music areas of the brain, I'll say it right, stay active. And so have you seen a rising acceptance and understanding of your work? Because I know, at least in the skilled nursing world, a lot more talk about using music therapy. So how is that translated to acceptance from a therapeutic perspective?
Yeah, I think, there's definitely a lot more awareness with different programs coming through all those places. I think there's still so much more advocacy, that I'm constantly doing, like the difference between a music volunteer or a music entertainer, which can have therapeutic effects, but it's not music therapy. You don't have that relationship, the one-on-one with an actual trained therapist, and also these specific techniques, which entertainers don't know. So it's definitely coming along. It's just it takes a while.
I was going to ask you about that, because not you, this is fun, but other music therapists I know, I'm sure there's a lot that frustrates them, but one of the big frustrations is when programs call it music therapy, but it's actually not. It's a musical experience, it's a music event, but I've seen very calm, melodic people get very angry very quickly when they mislabel as music therapy. So
yeah, that happens all the time, and it's like I kind of think of it as if you're going to physical therapy, you have a physical therapist as opposed to an exercise class or a trainer. Someone, it's there's a difference there. Like you say, you did your squats and I did physical therapy. No, you just did it's different. So.
Appreciating and honoring the therapeutic value. One of the questions I was going to ask later on, but I see my colleague Heather Burkhardt has asked about this. How does this get paid for? I have a question about how patients get connected to you, but are health insurance actually paying for this specific type of therapy?
Yes, unfortunately not in North Carolina so much. But some places there are, music therapists in Atlanta getting at least, 85, 90% of their caseloads covered through insurance. It just depends on how much we've fought and worked here. And I think it's coming along. And, there are music therapists in hospitals, in the psychiatric hospitals around, who are on staff and who get paid through, I am not sure exactly, where the funding source is, but they're on staff, full-time employees.
So you're not getting direct coverage. You don't get to bill insurance for your work.
I personally am not.
In North Carolina.
Yeah, but I know other music therapists in other states mostly are getting.
There was a question about insurance coverage. Is it covered only in a facility or at home outpatient? Since it's not covered at all, I know when I worked at a facility, it was just put in the operational budget, and it was seen as something important for residents and was paid for, but not covered. There was no reimbursement for it.
Right.
So that leads to my question, and please others feel free to throw some more in the chat. How do people come to you? So my loved one has a stroke, or my loved one has Parkinson's. How do they learn about what you can do?
Um, yeah, I get a lot of just word of mouth referrals. Um, and I work, I definitely provide a sliding scale for fees and just try to work with everybody I can. Um, does that answer your question?
Well, so it's word of mouth. I mean, they have to be connected to you, it sounds like, through some knowledgeable, whether it's a care manager or some other, I mean, most of your patients, are they coming from a doctor's office? Are they coming from a hospital? Are they coming from the senior center? Who's pushing, hey, music therapy would really help? Parkinson support groups.
Yeah, it's varied. The website, just people searching for music therapy have found me. And then I also work at Carol Woods and I've had private referrals through there. Um, you know, a lot of varied sources, but yeah, and doing presentations and doing, I'm meeting with the UNC Movement Disorders Clinic soon, just trying to get the word out.
Well, that's why it's wonderful that you're here with us this morning. I mean, it's amazing. And I've seen firsthand for years the power of music therapy. And then you and I were reconnected because we share a client. I was working privately with a couple, and he has dementia and loves music. And I said, what about music therapy? And they said, actually, where he's already meeting with this wonderful person once a week. And that's how you and I were reconnected. We figured out we were connected through a client so it's so great then that you're talking with the coalition, so that way, as a group of professionals and advocates, we can start to think about to make sure that this is I can't find my words, aware and eligible for other folks to have this. I did want to mention that in the coalition, we have a number of work groups. One of our work groups looks specifically at clinical practice. Another one looks at caregiver and patient engagement. And so I want to break those up for a second and say, how do you tend to work in a team or connect with others in the clinical practice setting, other providers?
I mostly collaborate with speech therapists since I do a lot of that type of work. And I've connected, with the UNC speech therapists and then some in private practice who have referred to me clients who think that, music therapy would be beneficial. And it doesn't have to be a musician. That's one common misconception is you have to be a musician to have music therapy. But anybody who likes music will benefit, and that's most of the population.
And then when you're for our group that looks at caregiver and patient engagement, what advice do you have for us? I'm active with both work groups, but in order of either helping caregivers understand that this is a way to help with their loved ones, or helping individuals themselves know about that this exists.
Yeah, I really love working with the whole family unit. And I hopefully I'm going to do a caregivers workshop soon. Would like to do some creative aging or creative caregiving workshops. And I've done a couple of those before, but it's such a powerful thing. And people, sometimes you think about it, but you don't really know, like, oh, if I do this slower music during this transition, then this is really going to help with agitation. Just things just to bear in mind. So.
Well, I wish I had more of your training, but Alie knows that as a family caregiver myself, I have sent her videos before my mom passed away of 3 a.m, humming along to Barbara Streisand, which was her favorite artist, and just how it helped put some sanity and calmness for both of us into just a really intense situation. And I want to go into a question that came in the chat line. I know for my mom, I knew what kind of music she really enjoyed. Is there a type or style of music that appeals to a large number of your clients?
No, I wouldn't say there's a specific type. It's a wide variety. I'll be singing Kiss one hour, and then the next hour we're doing, You Are My Sunshine, and it's very different.
I was just going to say that You Are My Sunshine. Somehow that seems to be like the go-to song just to start the group. Is that the warm-up?
Yeah, I think it's just one that mostly everybody knows. So that one's always good.
And
I just go ahead. I just wanted to mention that the best part of music therapy too is that you benefit as well. As the caregiver or as the team member, you're getting the same endorphin rush. You're involved, you're moving, your brain is completely activated in many areas. And it's just so good for you. So it's good all around. It's the job that I get to benefit from, in an interesting way.
Well, and that's why I didn't know, is this just me, or how much science, that explained why it added so much joy to, I've always loved music, but in a caregiving situation, it just also was a moment of, for lack of a better word, normalcy. We're no longer dealing with all the tasks, but we're just enjoying a moment together, singing Barbara Streisand at 3 a.m. So we have two interesting questions. One is on your website. This comes from Karen Appert. One of our coalition members saw the ukulele classes. That includes an option for caregivers. Tell us about ukulele and caregiver support.
Yeah, I started this during the pandemic when everything went virtual, and I was doing a virtual ukulele class. And I wanted to open it up for educators, caregivers, anybody who was super stressed at that time, and try to make it specific and give some therapeutic tidbits throughout. So we did that for a few sessions. It was a really fun time. Hopefully people could use that tool in their caregiving to have a little bit of joy during all that. And haven't done that recently, but maybe get it going again.
I think joy is a perfect word that describes what you do. I know, as I was sitting there singing along to the computer yesterday, I really encourage you all to go to the website, and I would have a hard time not following along, but you're like, sing along with me. And then I did. And then at one point you're like, okay, good. I'm like, thanks. And I'm like, you can't see me. And yet it's hard to not hum along. So I do, as I do a push for your OssiaMusicTherapy.com, before we end, I know we just have a few minutes, but why? And I always ask you if I'm pronouncing it right. Why Ossia? And not Alie Chandler Music Therapy. What's Ossia?
Ossia is a music term, an Italian term that used often in operas, and that indicates like an alternate passage in the music. Like you can do this alternatively. So I thought that fit well. It's a pretty word. I liked the sound of it, even though it's super hard to pronounce. But
I love what that stands for. That's beautiful. I think we're all trying to create alternative pathways now for ourselves and our loved ones and our patients, our clients who are experiencing things. I see that we have another question. I work for a healthcare system. We have music therapy in one location, and I'm looking to spread it to all locations and need to make the case for it. Any thoughts on how music therapy impacts patient experience in addition to the therapeutic value? Great question, Candace.
Yeah, there's tons of research. There's also research on cost effectiveness, how, it actually costs you less to have music therapy in the workplace. You have less burnout, less agitation of clients, of patients. People get out of the hospital sooner. They don't need as many pain meds. Talk about like a great non-pharmacological intervention that has no side effects, basically. It's a great way to, it's scientifically proven to decrease pain, increase mood, so many different things. There's many like meta-analyses. There's one recently on dementia and music therapy, and the two main outcomes for mood, like increased mood and stabilized mood, which is huge, and cognition. So, maintain cognition or improved cognition. Yeah, I can send Heather a list of resources.
Great. And then Candace, make sure I have your email. We'll make sure we have it. So we'll get that sent out, or maybe we'll send it to the whole group. And speaking of mood, I mean, you always make me happy, but I can't stop smiling as I talk to you. I think because I'm just thinking about the power of music. And I know it just, even just talking about it clearly is raising the joy level. But Dr. Bill Thomas of the Greenhouse, going back to this issue of whether it's a covered benefit, I know he as a physician said, I could write a prescription for all kinds of medication, it would be covered. But if I write a prescription for listening to this music that I have, or to get, back in the, an iPod, or, for people to be able to listen to, that's not covered. And yet the research continually shows the power. And now the brain imaging that shows the power.
Yeah. And I know that doctors do, write for music therapy, prescribe for music therapy, and that does definitely help our case when we submit. So it's happening.
I know. And since we do focus on advocacy, any last questions from the group about how to advocate to support this? And I know for my colleagues, I continue to call it a therapeutic intervention. Because it's music, it's so joyful, but it does have all of these benefits. So ways that we can work together as a coalition to help spread the word about that. Happy to do that. And let's think about more ways we can work together. And would love for you to join the coalition. I know I was talking with others, like, we'd love to have a music therapist on board. And so I'll rope you in, but any last thoughts either from you, from the group, as well as from you, of ways we can work together?
Yeah, I'd love to work together. It's nice to be connected.
And clearly, to share some research is one way, but I really encourage everyone to go to, clearly, I just keep doing a shout out for your website, just because it made me so happy yesterday. I love, as people, as our loyal fans know, I love to stalk the guests or prep, but yours was especially fun because I don't usually get to sing and go, but I can't thank you enough for sharing your craft with us and opening up our eyes. I want to keep going with that analogy, our voices, our minds, our brains to a new way of looking at music and the power of it. I want to thank the coalition members for joining us. We will hopefully see many of you next week for our monthly meeting. And our Friday Facts, October 28th, we'll have Tom Akins from Leading Age. And really, Alie, thank you so much.
Thank you so much. There's so much more I could tell you all about music therapy. So feel free to email me. Just find, the website has my email on it. So great. Thank you all for having me.